Well, cystic fibrosis is a genetic disorder or inherited. Every patient that has cystic fibrosis is born with cystic fibrosis.
It is not contagious. They are born with this. It is not anyone's fault, whether what someone did during pregnancy or even during birth.
In order for a patient to have CF, it's inherited as what's called an autosomal recessive disorder. And for a patient to have it, they have to receive an abnormal gene from each of their parents in order for them to have. So by definition, a patient with CF's parents are both carriers of the CF gene. But it's really important to note that parents don't have any control over what genes they pass down to their children. There's nothing a parent did or didn't do that resulted in their child having cystic fibrosis. Newborn screening is a nationwide program to identify certain health conditions in infants shortly after birth. Most people are familiar with this. If you've ever been to a normal newborn nursery and you've seen the nurses prick the baby's heel and they take the little filter blot paper and fill the little black circle full of blood, and that is the sample that's used for screening for a bunch of health conditions shortly after birth. And cystic fibrosis is one of those. Newborn screening is a screening tool by definition for CF. So if the newborn screening test is abnormal, then the physician will order certain confirmatory tests to make sure that CF really exists.
So cystic fibrosis is diagnosed sometimes through newborn screening. However, this is just a screen. If your child has a positive newborn screen test, then a sweat chloride test is scheduled.
So patients with CF lose too much salt in their sweat. And so the sweat test is probably the most common diagnostic test and still considered to be the gold standard.
The sweat test is a way to assess the functional aspect of the CF gene. And normally the baby comes to the lab in the hospital and both arms are covered by a band of sort that make them sweat in a very particular manner. And that sweat is collected, and then that collected sweat is reviewed and measured for chloride. And the abnormal chloride level will tell if the patient has or not CF.
When we went in for our sweat test, they wrapped Jack up in, I don't know, it was almost like saran wrap around his arms, and wrapped him up in blankets so that he would sweat. He was really comfortable. I held him the whole time.
I know I was worried because they put electrodes on his forearm that would allow it to kind of get warm and to cause sweat. And so I know that's where I was like, kind of a little worried, but he had no problem. He was more upset because something was on his arm than the heat. So really I was probably more upset than he was.
Different centers do different things at a newborn screening diagnosis visit. Most centers have a sweat test done that same day, and the family gets to meet most team members, such as a dietitian, respiratory therapist, a social worker, the physician, and a nurse.
One of the things that your center may be able to offer you when your baby's diagnosed with cystic fibrosis is to link you with another family who's been doing this for a little while. A family that has a child that's a little bit older that can provide you with just their experience of living with CF, because the CF team comes to you with a lot of knowledge and expertise. But the bottom line is they don't live with CF every day. And so a lot of times talking to other parents who are raising a child with CF is a real support to parents that are newly diagnosed.
We didn't understand the disease, but we knew that it was very, very serious. So it was really devastating, and it was nice to have family there and have each other. So.
Yeah, the doctors were great. The nurse was excellent. She was able to give us a lot of information and to let us know that it's going to be okay.
When we first found out that Madeline had cystic fibrosis, it came as a complete shock. I was sitting in my office and my cell phone rang and I saw that it was her pediatrician, so I picked it up, and he was wonderful. Let us know that some things had come back on her newborn screening that needed further testing, told me about cystic fibrosis. He let us know that he had already set us up an appointment at Children's Hospital for the next day for the sweat test. So there was a lot of shock, a lot of guilt, and just being scared.
When we found out that Jack had CF, our biggest support system was each other. Really talked about it, talked about our feelings, and I think that's what we have to continue to do, is be each other's support system. Because, you know, you get down to it and you think nobody really understands. But we do. I mean, we understand each other.
No, I think in our families, I think they were a big help in that. And I think it was something to rely on, and they're there to help and to do treatments and to help support us down that way, especially when we first initially hit or heard the information. They were able to support us.
To learn more about this topic and how the Cystic Fibrosis Foundation can help you, visit cff.org or call 1-800-FIGHT-CF.